I'm Dr. Kathy Bush.
And hello, I'm Dr. Tara Peters, and we are the Leadership Doctors. And today, for this segment of Lessons from Leaders, we have Dr. Mark Bush with us. And Mark is a former healthcare executive, and he is going to share more with you about that leadership journey and then also his current role. But we were really excited to have Mark on today because with everything that's going on with the coronavirus pandemic, we thought it would be really helpful to our audience to get some perspective from an industry insider, if you will. So Mark, welcome to the segment today.
Well, thanks for having me.
We're glad to have you here. So I think it's a great place to start in terms of level setting, Mark, for you to just give us some of your background. So describe your leadership journey for us and then share what you're currently doing.
I started out in retail management, worked there for about 3 to 4 years, went back to school, received my MBA with an emphasis in accounting and finance. I then started working for a healthcare organization in Michigan at the lowest level accounting job that they had. I did that for about 11 months, became a supervisor, then was transferred to a small facility in northern Michigan with that healthcare system, worked as a controller, moved into an executive vice president role and president role of the organization. Also was a vice president for the healthcare system's long-term care division and gradually moved into a CEO's role and gave up my financial responsibilities and worked as a CEO of a couple different hospitals, one in Florida and one in Michigan as well. During that time, I not only worked in hospitals, but as I mentioned, was in charge of long-term care, as well as the regional dialysis program that we had in 10 different locations in the state of Michigan. And then I also was in charge of physician recruitment and retention at the facilities that I worked at.
So Mark, you want to tell us a little bit about your current role and what you're doing right now? Because I know you got some cool stuff going on now also.
Currently, I am the program director of the undergraduate program at University of Central Florida for their Health Service Administration program. We currently have about 1,200 students that are in that program, and I teach their final leadership course, capstone course in that program, as well as teach in the graduate school for UCF in healthcare finance.
So Mark, for those of you who are watching, it's not a coincidence that the decor looks kind of similar in both of our screens. And so Mark is my husband. We're doing this quarantine thing together, and of course interested in what's going on for the many people that are working inside of healthcare jobs. Since Mark had so many years of an experience and is still very connected to people in the healthcare industry. It's a thing that we talk about a bunch. And Tara and I really thought it would be interesting for people who are not leading in this industry, but might be paying attention to what's going on to get a feel for what it's like to be a leader in a hospital, in a healthcare field that has all this crisis going on. And so can you paint a picture for us, Mark? What's going on for the leaders? What are the kinds of things they're paying attention to? And in particular, the human things, managing the employees that they have in the hospitals.
Well, I'm sure that from my past experiences, we always created, when there were crises like this that occurred, we created an emergency command center in which we had a lot of information coming into the one location where we'd be looking at staffing patterns for the current day. What did we need? Who was coming in? Who was called in sick? How many people do we have to find to fill in specific positions? What's our capacity within our organization? What's the capacity around other local healthcare facilities that are near us? What are our supply needs? Where are we today? What do we have for the next week, next several weeks, and what do we see happening? As well as working with local leaders as well in the public health departments for the local county, probably the local government, finding out what they're doing and what's happening from their perspective, working with the first responders. Again, my age, I was in charge of an organization when the H1N1 pandemic hit in the United States, and we worked every day with a morning call with the local leaders to determine what was going on currently and what did we see happening in the next few days, few weeks, so that we were ready and trying to prepare ourselves for the next steps and not get caught behind taking care of patients, taking care of our communities, which is our focus.
So Mark, as you were talking, one of the things I was thinking about was just, you mentioned your emergency command center and how you were using that to coordinate efforts and to ensure that communication was flowing in the organization. So of course, we're obviously seeing lots going on in the news around the challenges in terms of the industry, around staffing levels, around, you know, protective equipment, et cetera. And so as a leader, certainly you got to take care of those operational and staffing needs, but there's this human component. And so it would be interesting for us and for our viewers to know, in a time like this, if you were going to be in a role, right, and you were in the hospital and had to navigate this, what are some of the guiding leadership principles or values that would be informing your day-to-day work and interactions?
Well, I think the first thing is always communication. It's a guiding principle. You have to be able to communicate and talk with people. Make sure there's one common message. Develop that common vision for your whole team so that everyone knows what direction they're going. Everyone's bought into it, and that you're moving forward in that regards. The other thing that I think is really important and people have to understand is when you're in a hospital or healthcare setting, you have to empower the people who are out there taking care of patients and taking care of the other things within the hospital. It's not just about the caregivers, it's all the support staff and everyone else involved at the healthcare organization. And you need to empower them to make decisions and not get in their way. Make sure they have the resources they need and then let them do their jobs. Don't try to micromanage, because they know what to do. They know how to handle these situations, and they have the focus and that common vision. And I think that's really, really important. And also maintaining confidence. Be confident in what you're doing. Be able to make decisions with the best information you have. Know that it's going to change day to day, and know that you're just trying to do the best that you can with the data that you have, and know that you're going to make revisions based on new information coming in, and don't be afraid to adjust as you need to based on the newest information you have.
So as you know, Mark, because you have been putting up with this journey of ours to get this book written that Tara and I have written called The Demotivated Employee, and you've helped us out quite a bit along the way. So I want to ask you to think about demotivation right now for the people who are in the healthcare workforce. So, you know, the research says about 7 out of 10 or 70% of people in every kind of across the board in the workforce are disengaged at work. They're taking a paycheck but barely getting by. And so I don't know if that stat is specific to the healthcare industry or not, but let's just say there were already some disengaged people. Now we have this crisis. So what advice would you have for leaders who are in the healthcare industry, even leaders who are not, but also are facing an engagement problem? What advice would you have about what they should be paying attention to around this critical issue of engagement of their employees?
Well, you have to make sure you understand that the employees that you have are stressed, and they're stressed for a lot of different reasons. They're stressed because some of them are in high volume areas that are taking care of patients. Others are stressed because they're realizing that they're not needed right now because we don't have any elective surgeries going on. We don't have other things happening within the healthcare organization. And so the healthcare systems are having a terrible time with finances and deciding how they're going to survive long term. And what does that mean? Do we need to furlough some of the employees who aren't in the critical positions? And then what does that do to the rest of your staff when you do those things? Because whenever you lose someone or lay someone off, it has an impact throughout your entire organization. It's not just the person who's leaving, it's their entire family, and it's the family that they have left behind. And you have to stay focused on that as well. But again, I think that goes back to what I had mentioned earlier, and that is having that common vision. What are we doing here? Why are we doing what we're doing? And make sure you're communicating clearly with, here's what's happening, here's why we have to make the decisions we're making, and here's the direction we're going in. We all need to be rowing in the same direction. And give people praise for the things that they're doing. I think demotivated employees happen with a culture within an organization. And if you do some of those key things that you need to as a leader, you can avoid that demotivation. And again, I think that's important for leaders to understand. what motivates your employees, what's getting in their way, what are their roadblocks, and how do you help them get through that. And I mentioned that earlier of empowering people, letting them feel that they have their own destiny in their hands, give them the tools to make that happen and get out of their way. When you do that, you'll be amazed at how quick people will respond and how motivated they are. But again, I think it's really important because sometimes when you're in a crisis, you think only one person can make the decision. And what I have found is when you delegate that responsibility, you'll be amazed at how smart the people are and what they can do when they really need to. And if you give them the tools, they'll take care of it and they'll stay focused on what's important.
You know, Mark, you really shared some great insights and perspective to really help leaders. And I think a part of helping leaders also is really helping them to think about how to grow and develop themselves. You talked about at the beginning of our interview how you started at the lowest level in the organization, and then over a period of years, it wasn't instantaneous, it wasn't overnight, you became a CEO. And so given your experiences, we have folks who are likely watching this video who are at various stages of their career. Some may be in the middle of it. Some may be in the middle of that career path and kind of thinking about like what is their next step in terms of having advancement opportunities. So talk to our audience today about what would be your advice based upon your experiences on how to grow and to develop themselves.
Well, I think the main thing you have to do is you have to look at who are you using as your mentors within your organization and within your industry, and rely on them to help you through the process. Never say no to an opportunity, even if it may not be the opportunity you think you want. Never say no. Look at it as a growth opportunity and a chance to learn new things and do new things. When I went to the hospital in the northern part of Michigan, I never realized that I was going to be in charge of long-term care. I learned a whole new industry. I learned a whole new business. And for me, that was a great experience. And I got to work with some wonderful people and in a whole different aspect of healthcare that is nothing like an acute care setting. And for me, that was an awesome growth experience. And look for ways to build your own leadership skills, your own styles, creating that network, working in healthcare, for instance, in your local ACHE chapters, your HFMA chapters, and work closely with the people within your organization. Just because you have a specific function, in my case, it was finance. What I got to do is I got to work with people in clinical settings, learn as much as you can learn about the business that you're in, and you'll be amazed at how that will help you going through an organization and growing in an organization. Because when your leaders are talking to people in the organization, they go, oh yeah, I remember that person coming up and finding out about me and about my job. It starts to build that sense of you care about not only yourself, but you care about the people that work in your organization and your community. And I think that's really, really important. And be involved in the community you work in. You'll be amazed. You never know where that next job opportunity is going to come from or how that first job opportunity is going to occur. Mine luckily came from a gentleman who was a treasurer of a major corporation. He had no positions open for me, but he gave a phone call over to the CEO and CFO of a healthcare system and said, hey, I got this guy in my office. We'd love for him to come to our community. We are on a hiring freeze, and I know you have some openings in the healthcare system. Would you at least interview him? At least I got the interview, and from there, good things happen for me, and I hope the healthcare system feels good things happen for them as well, because it was a great experience. And I think, again, just never say no and always be willing to learn and always be willing to try new things as a leader. And don't think that you've got it figured out, because if you're not growing and learning, you're actually falling behind.
Well, that's great advice, Mark. And you know, I'm so happy that we get to share with our audience some of the kinds of conversations that you and I have been having, certainly directly as this crisis has been unfolding for the healthcare industry and for us as a society, but also as in the big picture, your philosophy as a leader who's had great success and been loved by lots and lots of employees as a really excellent role model and mentor for them. So thank you for sharing with us. For those of you who learned something valuable in this interview. If you want to head over to our website, we have other lessons from leaders available for you there or on our YouTube channel. So you should be able to click on a link, but it's also available at theleadershipdoctors.com.